all over India, all the states are observing this event today. In Nagaland, we have drawn a road map starting today after the official launching by our Honorable Minister. This event will be observed all over the districts of Nagaland. We intend to reach out to all nooks and corners of our state. Therefore, for your information, we will be covering 520 schools spread over a period of 2 months, that is from starting today, culminating on the 12th of October. So, 520 villages are marked for 376 schools, 110 colleges. And throughout this campaign, we will be having for awareness, as an awareness exercise, we will be having folk shows, flash mob dances, and precisely we have targeted 5,200 households to be covered. But at the end of the day, we are looking forward to achieving more than what we have targeted for. So on behalf of the Nagaland State AIDS Control Society, I extend a very warm welcome to each and every individual present here today. And thank you so much for being here and making our event a grand success. Thank you very much.
Fifth semester Kohima College humbly stands before you all to appeal to all of our common future. Our Nagaland faces an HIV prevalence rate of 1.37%, far above the national level. People living with HIV, 21% of them under 24. Addressing this challenge requires prevention, awareness, and care. The Nagaland State AIDS Control Society and SEX, alongside District AIDS Prevention and Control Units, DAPCUS, has been working tirelessly to raise awareness, provide testing, and support for those affected. Their efforts prove that collective action can help save life. The theme, "This is our time, Young Voices for a Healthier Future," resonates deeply with me. We are the generation that can break down barriers, challenge stigma, and advocate for a better healthcare.
Today, this event, the intensified IEC Campaign 2.0, it aims to increase the knowledge about the HIV and STI, promote safe practices, reduce stigma, and encourage testing and treatment. It is a reaffirmation of our shared commitment, our collective will to protect the health, dignity, future of our people of Nagaland. We gather here not simply to launch a campaign, but to renew our pledge to work together for a healthier, more informed, more compassionate society. HIV and other sexually transmitted infections remain a serious public health challenge. Over the years, the government of Nagaland, through the Nagaland State AIDS Control Society, has worked tirelessly to spread awareness, provide testing and treatment services, and fight the stigma. Awareness must be continuous, innovative, and must reach deep into our communities, meeting people where they are. So is this launching of this intensive campaign so that we reach our target, we reach the unreached, we are unable to reach, so everybody is informed. This intensified IEC campaign is important for three reasons. First, it is intensified. The message must be loud, clear, and impossible to ignore. It is youth-driven. Our young people are not just leaders of tomorrow, but they are the change makers today. It is sustained, it should be sustained. The real behavior change should be there, and reduction of stigma take time, effort, and the reduction of stigma takes time, effort, and consistent engagement. This is in line with the NACO's vision of future, where every individual has the knowledge, tools, and confidence to make informed choices, where HIV transmission is halted, and where no one is left behind because of fear or discrimination. This vision guides our work in Nagaland and gives today's launch its true meaning. The government remains committed to ensuring that every person in Nagaland has access to accurate information, quality health services, and supportive environment where they can make informed choices. No one should be left uninformed, no one should be denied care. Our approach will be multi-pronged. We will strengthen IEC activities through traditional outreach, creative youth-led initiatives, vibrant social media campaign, and school and college programs. We will work hand in hand with influencers, educators, faith leaders, community champions. We will empower our young people to take the lead through interactive events, sports, music, quizzes, digital storytelling, and peer education. But the success of this campaign depends on all of us. Let us move from awareness to action. Let us talk openly about HIV and STI. Let us seek testing and treatment without fear. Let us reject myths and misinformation. Let us stand together against stigma wherever we find it. On behalf of the Government of Nagaland, I pledge our unwavering support through resources, policies, and partnerships to this cause. Together we can build a Nagaland where every person is informed, empowered, and treated with dignity. Thank you so much.
Let's separate our connection all together. In a world from shining today. Let's talk about the ways of HIV prevention. Hey, 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 hey. What you wanna say? That's the decision. It's 29 donations. Every single union verified. Choosing letters and the calling out the sharing leaders. Knowing all the facts to figure out. It's every story gone. Let's make it now strong. Let's make all together. Free the world from HIV today.
Where all of us are with good health present to attend this occasion. It is indeed an honor and a privilege to address you all on this significant occasion. As we launch a 2-month campaign on intensified information, education, and communication in Nagaland today. Information is not just a data, it is empowerment. Education is not just learning, it is transformation. And communication is not just words, it is connection. Over the next 2 months, we will reach out to communities in every nook and corner, in urban cities and in the rural, to young and old, taking with us not just information, but inspiration. We know that information alone is not enough. It must be communicated in ways that connect with people's life, beliefs, and aspirations. Friends, Nagaland stands at a crucial moment. As per Integrated Counseling and Testing Center, ICTC program data, Nagaland HIV epidemic has been moving towards a steadily decline over the past few years. However, the concern is that the prevalence of HIV amongst the adult population of 15 to 49 years is at 1.37%, which is still at the second highest prevalence in India. Therefore, this day, we have the presence of honorable members from the Nagaland Legislative Assembly, where they would be disseminating this information to the rural masses. Nagaland epidemic is driven by transmission through first unprotected sex with an infected person through the sexual route, which contribute to 85% of the infection. Secondly, through injections routes from an infected needles and syringes is at 8.7%. And the third route from an infected parent who are not on treatment to the unborn child is only at 5.4%. As of June 2025, a total of 15,323 people living with HIV are on retroviral therapy treatment, which is mentioned as ART. Nevertheless, Nagaland is also one of the states in India which has established opioid substitution therapy, OST, we generally name it. Centers in all the district hospitals, some CHCs, PHCs, health and wellness centers, and through NGOs. At present, we have 64 centers providing treatments, therapy to more than 10,000 injecting drug users from across the state. The OST is a part of a harm reduction approach to reduce the risk of getting other infections due to drug use and facilitate recovery from the drug use. However, friends, campaign alone do not create change, but people do. You do, the health workers on the ground do, the community leaders, the media voices, the young advocates. Each conversation you have, each poster you put up, each story you tell has the power to change lives. Therefore, let us us move with patience. Let us speak with clarity. Let us act with urgency. If every one of us takes responsibility, this campaign will not just be an advance, but it will be a movement. Together, let us make sure that in Nagaland, knowledge travels faster than disease, hope travels faster than fear, and action speaks louder than ignorance. With this, I thank the department, I thank all the students, I thank all the guests, all the dignitaries present here today. And my speech, I end with the official launching, seeking God's blessing for the doctors, health workers, partners, and infected person with HIV and STI. I officially launched the intensified, informative education and communication campaign on HIV and STI today in this platform. With this, I come to the launching program. Thank you. God bless.
I pledge to protect my health, respect others, and speak out against stigma. I commit to make responsible choices, seek correct information, and support those in need. Together, we will spread awareness on HIV and STIs and build a healthy, safe, and stigma-free Nagaland. Thank you. We shall now take an official group photo to mark the occasion.
So here's a message to the viewers. So as you know, we have come to this event. It's the launching of the intensified IEC campaign. So if you are out there and if you're afraid and if you're shy or embarrassed to get tested, don't be. It's all confidential. It's all for the betterment of your health. So don't be afraid. Take a step and make sure that you live a long life. So get tested soon.
Hi guys, this is Moko. So as part of today's campaign, I'm also doing my job as a fellow citizen, spreading the positive message about HIV, and my message to all the people out there, let's not discriminate but embrace each other. Thank you.
Hi, my name is Hikalia Chumi, Miss Nagaland 2022, and also an ambassador of anti-drug campaign SIG. So I am so excited to be in this campaign because this campaign it's not only about sharing information, but it's also about inspiring changes and breaking the stigma. So very happy to be here and so much looking forward how this campaign will impact and bring a real change in this community. So a lot of us thinks about this HIV disease as stigma, and this is the reason this campaign is all about sharing and information, being informed, so that we will not just view HIV disease as a stigma, but also normalize it as any other disease. So normalizing and breaking this stigma is all about this campaign. Thank you.
Hello everyone, my name is Akavi, also known as the Red Letter J. I make cringe reels on Instagram, so if you haven't checked out, do that. I am a teacher by profession, and today I'm here at IEC, the launching of IEC campaign. And Ajila, through this campaign, the message is very clear to take care of our health, to take care of our body, get yourself tested, and also to break the stereotype, to break the stigma that is present in our society. So, Manogi discriminate nukrivi, stigmatize nukrivi. Let us all come together and break this chain and take care of our body. Thank you.